The aortic aneurysm is a condition that's a valve in the aorta. We're going to define it as an aortic aneurysm when the size of the aorta getting bigger than 1.5 times to normal. In the belly, we're going to define this as the aortic aneurysm when it's getting bigger than 3 centimeters. The cause of aneurysm can be atherosclerotic disease or degenerative disease. This is a condition where the plaque or the lipid deposit in the wall of the aorta, causing the weakness in the wall of the aorta, and inflammation and the infection can also causing the weakness in the aorta in some kind of infection disease like tuberculosis or syphilis, and some kind of inherited disease like Marfan syndrome can also causing the weakness, and injury to the aorta can also causing the weakness. The aortic aneurysm is common in men than women, about 4 to 6 times, and it's also common in the people with advanced age, older than 65 years old. In general, at 50 years old, the risk of the aneurysm may be around 1%, and it will increase 4% every 10 years that age increasing. It's also common in the patient with a disease like hypertension and diabetes, which causing the weakness in the wall of the artery. In the patient with a family history like Marfan syndrome, earlier than loss syndrome, will have a higher risk of aortic aneurysm, as well as the inflammatory disease like Takayasu disease and Behçet disease or hormone disease will have a higher risk also. Moreover, another risk factor that's causing the aortic aneurysm is smoking. If you have one of those risk factors, I would recommend you to see the expert at the hospital to do the screening program. Most of the people do not have any symptom, but about 20% of the people may come with the symptom. The most common symptom is the pain in the chest and the pain in the belly, and the pain is mostly related to the pulse. In some cases, the patient may come with a compressive symptom, such as the aneurysm may compress on the esophagus. The people may come with the difficulty swallowing when it compresses on the vein that go to the arm or leg. So the patient may come with the swelling of the arm or leg, and in some cases, it may compress on the bowel and causing the small hole connected between the bowel and the aorta, causing a lot of bleeding into the bowel. In some cases, it may throw the blood clot from the aneurysm to the blood vessel that supply the arm or leg, that causing the reduce in the blood supply in the arm and leg. In the screening, there are two most common locations of the aortic aneurysm, in the chest and in the belly. In the chest, we're going to do the CT scan for the screening. In the belly, we're going to do the ultrasound for the screening. There are two options to treat the aortic aneurysm. The first option is open surgery. The surgeon will open the chest or open the belly and fix the aneurysm by cut and seal the graft into the aneurysm. Another option is endovascular surgery. The surgeon will insert the thin tube or the stent graft from the arm or leg into the aneurysm to reinforce or repair inside the aneurysm. By using this minimally invasive technique, we can shortening the length of stay in the hospital, and the patient will improve and get out from the hospital faster than the conventional method. In some cases, when the patient comes with a complex aneurysm, the surgeon needs to treat the patient combined with the open surgery and the endovascular surgery. We call the hybrid surgery, which need a lot of expertise, not only the surgeon, but also we need a lot of expertise from the team, and we need to bring the patient into the operating theater. We call the hybrid OR to treat the patient. At Bangkok Heart Hospital, with the multidisciplinary team, our expertise, and the cutting-edge technology, then we can ensure to get the best outcome in every patient.